Welcome to Surgical Technology. We've composed a short video to discuss some of the major topics that you will come across in your field of surgical technology. We're going to open up with job opportunities, some professional and personal skills required to succeed. We will discuss OR attire and the surgical setup, and then we will complete with each surgical team member and their roles in the OR. There are many job opportunities available to you upon graduation from the K-Hub accredited schools such as Delaware Technical Community College. The more common are in surgical centers, hospitals, veterinarians, and doctors' offices, or even for a private physician. There are some new trends that can take you to employment, such as a traveling surgical technologist, or even in tissue and organ transplants. To be a successful surgical technologist is more than just knowing your anatomy and procedures. Some professional skills important would be having a great surgical conscience. What I mean by this is doing what's right all the time, when no one's looking. Did that tool just drop on the ground? You better say something, because that's an important characteristic. Another important would be your critical thinking skills. Professionalism, being on time, you need to be reliable. These are important professional characteristics to be successful. To work efficiently as a team, you need effective communication. This is a personal characteristic that will take you and your team members far. You also need to be honest, dependable, and reliable with a good, strong integrity. What this means is to show up on time, be willing to do the best of your abilities all the time. So come with me and we'll get you changed into some proper attire.
OR attire plays an important role in keeping the microbial count to a minimum, which reduces the risk of infection for the patient. We are now in the unrestricted area where we are expected to change into our surgical attire. First, we want to put on our head covering. We want to make sure that all our hair is tucked in so that it doesn't fall on your clothes, as it can be a major contamination. Then we want to put on the rest of our attire. There are certain attire that is required in different areas of the hospital. You want to make sure your shirt is tucked in and that your strings are tied and tucked in as well. You want to make sure that your attire is close-fitting so that you don't contaminate other things around you. This is a semi-restricted area where only personnel with surgical attire is permitted. This is also where you put your shoe covering and your mask on. Your shoe covering is to prevent cross-contamination from the OR to the outside areas, and it also protects your shoes from fluid contamination. Your mask should be worn at all times in the restricted area as well around the sterile field. You want your mask to be snug fit, and this is to contain the moisture droplets from your nose and your mouth. Welcome to the restricted area. This is where the highest level of precaution is taken to prevent contamination. This is also where personnel wearing surgical attire as well as a mask is permitted. After washing my hands, I will come over and take a sterile towel to dry my hands. I will then put my gown on. And your circulating nurse will tie the back of you. You will then glove yourself. the first couple times, but you will become a pro at it with lots of practice.
Today we're going to play a game called Who Am I? What I'm going to do is, it's kind of like charades where I describe something and you guess who am I. So I'm going to walk around the table and I'm going to describe some of the surgical team members and the different tasks that they do throughout the stages, whether it's intra, post, or pre-operative surgery. So right now, this person would be in this position. And what this person does is maintain vital signs. They give the anesthesia. Does anybody know the answers? I am the anesthesiologist. Okay, on to the next. So now we go over here. And what this person does is provide follow-up care and actually performs the surgery. Do you have any idea who I am? I'm the surgeon. Okay, moving right along, this person will actually be standing outside of the sterile field. This person will do the timeouts. This person will assist with the instrument preps. This person will also bring the patient in. Does anybody know who I would be? I'm going to be the circulating RN. Okay, to the next person. My position will be here. What I will do is pass instruments to the surgeon, maintain a sterile field, and assist the next person on the side of me. Do you have any idea who I am? I'm going to be known as surgical technician. Okay, so what I do is actually give extra visualization to the surgeon. I also assist the surgeon and I dress wounds. Does anybody out there know who I am? I'm the surgeon's assistant. So now, everyone, we know who the anesthesiologist is. We know who the surgeon is, the circulating nurse, registered nurse. We know who the surgical technician is and the surgeon's assistant. Their roles and different tasks that they complete during pre, intra, and post-operative phases.